Every week, more Ohioans become eligible for COVID vaccines.
But the next group that can get their shots is in a very difficult position. We're talking about Ohioans with severe medical conditions like cerebral palsy, sickle cell anemia, or lung disease. They can get their COVID vaccine starting on Monday, but News 5's Kevin Barry explains it took until just yesterday to figure out how to schedule their appointments.
I took the shelter in place very seriously.
COVID protocols are no joke for Colleen Gerber. The two-time kidney transplant recipient is less than 65 years old, so she doesn't qualify for a COVID shot because of her age. But her transplanted kidney puts her at risk, and the state was silent about how people like Colleen, who have a serious medical condition, can get vaccinated until Thursday.
Well, it's sort of like waiting for an organ, for that call when you're on that waiting list.
To some extent, we are relying on people's good faith.
Late this week, Governor DeWine announced that people with those serious conditions can get vaccinated at any provider just by claiming to have one of the specific conditions. No doctor's note and no medical paperwork needed.
To erect a bunch of barriers because a few might abuse it did not seem to be the logical thing to do.
Governor DeWine says most people with those conditions likely already have a relationship with a hospital system and can get vaccinated there. University Hospitals has posted a link allowing people who qualify to pre-register, and that link is already tens of thousands of names long. But UH says there is some good news.
There's a lot of air that comes out of that list, and that's great.
UH's Cleveland Medical Center Chief Operating Officer Dr. Robin Strosaker says that's because so many people are signed up on multiple lists that by the time UH gets to them, the patient is already set up somewhere else. She doesn't mind the state relying on the honor system to give out these vaccines because verification would be really hard and the alternative isn't better.
We could be missing out on the opportunity to be vaccinating people who truly are vulnerable and at risk, and we didn't want to do that either.
The Cleveland Clinic and Metro Health both tell me they're ready to start vaccinating those additional Ohioans once they become eligible on Monday. The state says they'll be monitoring vaccination rates to make sure that that high-risk group is getting vaccinated and to try to watch out against fraud. No word yet, though, on what the state will do if they catch people lying to get the vaccine. In Lakewood, I'm Kevin Barry, News 5.
Now, we just heard from Giant Eagle and Discount Drug Mart. They tell us they plan to follow the governor's guidance for vaccinations in Ohio with one of those special conditions. Meantime, Governor DeWine has said Ohio's vaccine priorities, all based on making sure people who are most likely to have bad outcomes from COVID get vaccinated first. That includes Ohioans with developmental disabilities in Cuyahoga County. A little more than 5,000 adults have developmental disabilities. Many of those people were vaccinated in their congregate care facility.
And I'm happy to say the vast majority of individuals in Group 1A have now had the opportunity to be vaccinated.
The board held community clinics and vaccinated about 800 more people over a weekend. They have another clinic Saturday for anyone who still has not gotten their first shot.